26 years old. I am, like she said, a senior here in nursing school. I recently got a double lung transplant in June. That was obviously the probably hardest thing I've ever had to do. I'm pretty young, so I have a little bit to go. But so I was admitted June 4th for my transplant, and I got my transplant June 24th. And it was a very surreal kind of experience. I've had a serious lung disease since I was 19 years old. It's called hypersensitivity pneumonitis. It's a very long word, and a lot of doctors, I'll tell them, they'll ask me my past medical history, and I'll say, oh, I have chronic hypersensitivity pneumonitis, and they're like, can you explain that a little bit? And yeah, so it's a very rare disease. Not a lot of people get it. It basically means that your body is very allergic. It's severely allergic to a certain antigen, and antigens can be birds, they can be mold, they can be fungus. There's one that's called hot tub lung. Like if you go into a hot tub and it has fungus or mold in the hot tub and you're breathing it in, it can severely damage your lungs. So that wasn't me. Mine was a little bit weirder. It was a bird fancier's lung. So that basically means any bird feathers, droppings, down pillows, down blankets, jackets, anything like that with feathers, I was severely allergic to. So when I was younger and I lived with my family, we had these little parakeets from like the pet store, and I think we had 2 or 3 at the time, and then they started hatching eggs and all of that, and we had to get rid of them. But they were the reason why I was getting sicker and sicker. So what happens with bird antigen, which is a little bit different than your like regular allergies like outside or to dogs, the bird antigen is very, very small and very, very thin. So it can get down deep into like your alveoli and scar it. So what was happening was I was breathing in this bird stuff, and it was severely damaging my lungs. So for a normal person my age, around 19, your lung capacity, which is your ability to breathe in and out, it's about 90% to 100, and mine was like 40%. So that's like a COPD patient, if you ever heard of them, or somebody who has smoked their whole life. It's kind of like I was like that at like 19 years old. So that was hard for me. I was really young, so I didn't understand like the severity of it. So I lived my life like I wasn't sick, and that was a problem. I didn't take my medicine. I didn't follow up on my appointments. It was horrible. I think I didn't take it really seriously until I turned about maybe 23, 22. And I kind of started to be like, all right, this isn't right. Like I'm not feeling too well. Like I was like, I could do things and like go to the gym and still live my life. I was a little bit depleted. Like I would notice myself getting really short of breath, really like fatigued. I would cough a lot, and they kind of were just like, your lung capacity is nearly more than half of what a normal person's lung capacity is at your age. So what happened was I got referred to a Christiana-Care pulmonologist, which is a lung doctor, and he kind of followed me. He put me on immune suppressants and steroids, which kind of slows down the progression of the disease. It was weird in my case because once you get taken out of the environment where your antigen that you're allergic to, once you get taken out of that, if everything's good with you, you kind of get better, which I wasn't. I was getting worse and worse and worse. So at 19, I was 40% for my lung capacity. And then I think around, I went to Johns Hopkins. I had 2 pulmonologists because they were kind of concerned about why I was getting worse. And they wanted to figure out what was going on, but they never could. So I was getting worse over the years. And then by, I think last year, was it October or November? I got a sinus infection and it wouldn't go away. So I was like, I don't know what's going on. And I was in Miss Franzer's class and she was like, you look horrible. You need to go home. So I had like a heating pad over my neck and I felt horrible. And it wouldn't go away. So I was like, maybe it's just my immune system. You know, I was already immune suppressed. Maybe it's just like prolonged because it takes longer for you to get better if you're immune suppressed. So I was like, all right, well, maybe it's just my sinus infection that's just dragging. And then like around November, mid-November, I was sitting with my husband at home and I think we just had spaghetti or something. And I was doing dishes and I felt like it was like heartburn in my chest. And I was like, oh, well, I just had tomato sauce. Maybe that's why. So it was like, I was more short of breath and the heartburn got worse and worse. So I was like, okay, you know what? I'm just gonna go to sleep, take some Tums. And so it was like maybe 1 a.m. in the morning. I see him like staring at me like this. And I was like, what are you staring at me for? And he's like, he could hear like bubbling in my chest. Yeah, and it was like, it was a pneumothorax, which means like you have a collapsed lung. So how do I explain that? Okay, so a lot of people have blebs. Well, some people have blebs that have lung scarring, not a lot of people, but I had a bunch of blebs on my lungs and one of them popped. So when one of them pops, your pressure from the outside of your lungs starts to rush into your lungs and it kind of basically collapses your lung. So I was working with like one lung at the time and I was like, I don't feel good. I feel like a piano dropped on my chest. I don't know what's going on. And he was like, well, let's just go to the ER. So we went to the ER and I had what was called a tension pneumothorax. So that means the air is so severe in your chest and it's collapsing your lung and it's pressing against your heart. So when it was pressing against my heart, it started to press on my other lung. So what they do is, I don't know if anybody's heard of a chest tube. Yeah, so they put in a chest tube and it kind of equalizes the pressure and it re-expands your lung. Well, mine wasn't re-expanding, it kept collapsing. So I had to stay in the hospital. I think I was in the hospital from November to like January. Yeah, in and out of the hospital from November to January. I spent Thanksgiving, I spent Christmas, I spent my birthday, I spent my anniversary, I spent New Year's, all that in the hospital. And I kept getting these pneumothoraces and then so what happens is it starts to scar your lungs even more, which I really didn't need. But it started to scar my lungs with them taking the chest tube in, taking it out and all that. So then I was okay for a while. I kind of bounced back a little bit, but then I started to need 6 liters of oxygen, which is kind of like your body is just, your lungs are just like, I'm about to check, like I can't do this anymore. I need supplemental oxygen. I've gotta, find a way to get blood circulating through my body that's oxygenated. So I was on 6 liters and I remember we planned our wedding, we paid for it. And I was at my bridal shower. And at that time I had pneumonia, but I didn't know that. So I couldn't even walk from here to over there without being like short of breath. And everybody could notice it, but nobody said anything because it was my bridal shower and they didn't want to be rude. But so that happened. And then I seen my pulmonologist at Hopkins and she looked at me and she was like, you know what? We're going to put you on the transplant list because you're not going to last much longer with these lungs. And I was like, okay. I was like, I guess. She was like, we're going to admit you now, today, which was June 4th. And she was like, you're not going to, because some people, they can go home and they can wait for their new lungs, but that's if they're stable. I was so unstable to the point where she was afraid to send me home. Like it was that serious. And she was like, we're going to admit you today and you're probably not going to go home until you get new lungs. So I was like, all right. And he was sitting there with me and I obviously cried because I was like, this is like something that you don't think that you have to go through when you're 26 years old, where you're like thinking about, am I gonna die? They basically told me if I didn't get new lungs soon, I was gonna die. So June 4th, I got admitted, and then every week I was so sick to the point where they have you on a transplant list, and the sicker you are, the higher you are on the transplant list. So I was getting sicker and sicker by the week, and to the point where I was in the ICU. I had what they call high flow oxygen because the 6 liters weren't enough for me, and my CO2 levels started to build, which is, it's kind of like you breathe in the oxygen and then you breathe out your CO2. I was not doing that. I was keeping all my CO2 in, which is very damaging to your body. You can get confused. They start to they intubate you just so you can stay alive. So I think every 3 weeks, every week I got a call, and what they do is they prep you. The first time I remember the doctor, the surgeon, he's the best. His name's Dr. Bush. He came in and he said, we have lungs for you. And I was like, oh, yay. And I was nervous too, but my family was all there, and we all said our goodbyes. We cried and all that. And I got sent down to the OR. And what they do is they prep you and do all that. And they did the epidural for the pain and stuff like that. And then they don't know what exactly the lungs look like until they open up the donor. So, and they have to do it quick. Like, they have to take the donor lungs and put them in the recipient quick. So they opened up the lungs and they were like, these are not good lungs. These aren't even good enough. So they, I remember I woke up in my room with the same lungs, and I was not happy about that. I was still on oxygen. I was like, all right, so you just sent me all the way down there for nothing. Okay, so that was my first week, and I opted to do the high-risk donor pool, which not a lot of people do. I'm a part of this Facebook group of all these people. It's all older people. But they, a lot of them opt out of the high-risk donor pool because they're like, it can be somebody who's been in jail, it can be somebody who smoked, it can be somebody who has hepatitis C. And I actually, it was the second time I got a call. Those were hepatitis C lungs, and me and him were like, do we really, because you can say, no, I don't want these lungs. And me and him were like, do we really want these lungs? But they reassured me that you will get the lungs, and if you contract the hepatitis C, we cure it. So I was like, and my doctor kind of was frank with me, he was like, you're gonna die if you don't, do this donor pool. I suggest you do the donor pool. So I was like, okay, I'll do the donor pool. And there's another high-risk donor pool where they take damaged lungs and they reperfuse them. They put them, it's like a lung in the box. It's like this big warehouse with all these lungs. Yeah, it's like this big warehouse with all these lungs in boxes, and surgeons, they'll go around. It's like they pick the best ones, and they're like, oh, I like those, I'll take those. So they all get reperfused. They're damaged and they get reperfused, and they get put in people like me. So I chose that too. I didn't get that. No, I never got offered a lung in the box, but I did get offered a hepatitis C, and that was my second offer, and I took it. But my surgeon, we went down, I got prepped, and I went back upstairs with the same lungs. That was the second time, and he took a video because he knew I was getting frustrated and I was scared because I was getting worse and worse, and he was like, look, he took a video of the lungs, and he was like, look at these lungs. These are not good lungs. So I was like, so my family was like, yeah, they were shriveled. They were like mine. I wish I would have brought pictures, but they were kind of graphic. I do have it on my phone if you guys want to see it. Okay. It's like my cavity. So they open me up this way. Not a lot of surgeons can do that. They usually do it right here and they do it around. But he was skilled enough to where he could do it under my bra line and open me up this way. It's still painful, but it's where I can wear a bra, I can wear a bathing suit, and you won't see it. I do have my chest tube scars, and those are a little, they're dark. And I have my IJ, it's like a big line that they put in your neck, and I still have that. But anyway, that's another thing. So the second time he said, these aren't good lungs. And then finally, the third time, that was once again, I went down, I got prepped, no lungs. So I was like, you know what? Me and my body and God need to have a serious conversation because I'm sick of this. I was like, I'm getting sicker and I need lungs. So what they were about to do was put me on ECMO, which is basically life support, where they kind of let your body rest, let your lungs rest, let your heart rest, and a machine pumps blood and pumps oxygen throughout your body. And I didn't know what it was until my husband looked it up. I knew what it was because I heard it in nursing school, but once you hear something and you go to the next class, it's kind of like, oh, I think I remember that. But my husband, he looked it up and he was like, that's basically like life support. So I was like, oh no, I'm not doing I'm not doing that. I can't do that. So me and God, we had a serious conversation, and then the next week I got 2 offers. So my surgeon was like, you know what? I'm gonna take both of these offers. He's all that. Like, he can do what he wants. It's crazy. He can do what he wants. So he took both of them. He was like, I'm gonna give her the best chance she can possibly have. So I got prepped. I went down, and one of them, he was like, no, these aren't good. And then the other ones that he was like, these are beautiful lungs. We're gonna use them. And then they tried to put them in my chest, and they were too big. So he cut. So what they usually do, you can live with 2 lobes on both sides. So, like, I think your right lobe has 3.
Yeah, your right has 3.
Yeah.
Your right lobe has 3 lobes. Your right lobe has 3 lobes, and your left lobe has 2. And he took a couple. He asked my husband and my family if that's what they wanted to do, and obviously they were like, yeah, like, do what you got to do. If she can live with it, then go ahead. So he took, I think it was an 8-hour surgery.
8 hours, yeah.
8-hour surgery, and he took a couple extra hours, and he cut that 3rd lobe and fit him into my chest. So like everybody else, I'm not normal still. You guys have 3 lobes, and 3 on one and 2 on one. I have 2 on both. But it's working, and it probably was the best thing. I mean, obviously, I had to put my wedding aside. I had to put everything aside, and it was probably a couple weeks before my wedding. And they were like, I think my wedding was like June 16th or something like that. And I got admitted June 4th. And they were just like, you got to put everything aside. And I was like, you know what? I'm going to do it, because I would have, if I didn't get admitted, I would have had to walk down the aisle with an oxygen tank. And I didn't want to do that. I wanted to be cute. So I was like, no, I'm not going to do that. So I was a little heartbroken that I had to put aside my wedding. But I was like, do I really want to walk down the aisle and dance with a big tank and no. So I was like, all right, I'll get admitted and we'll have our wedding next year. So that's what I did. And I think the hardest part about my transplant, it was a couple hard things, but before it was thinking I was going to die, because they were pretty honest with me. They were saying, you could die here, not getting, I knew if I wasn't going to get the lungs that I needed soon enough, I was going to be put on ECMO, and that takes a toll on your body, where it's like to the point where they give you your new lungs, but your body is so damaged from the ECMO that it's hard to bounce back from that. Like, you'll have your new lungs, but your body is just shot from this machine. Mm-hmm. So that was
last ditch.
That's like and they came in.
You're most likely gonna die.
Yeah, and they came in there and they were all nonchalant, like, yeah, we're considering ECMO. I think they didn't want to scare me. And they were like, yeah, we're considering ECMO, if you don't get lungs in the next couple weeks. And I was like, oh, okay. I was like, all right, cool, like, it's not a big deal. And then they left, and he looked it up, and I was like, oh no. I was like, no, I can't do that. So I didn't know how serious it was until he told me. And then the ICU, was probably the hardest part. So when I first got a surgery, I obviously was out of it. I was sedated for so long that I was combative. I had a breathing tube in, and they restrained me because I was not acting right. I was pulling out my restraints. I was trying to pull out my tube. This is from what my family, my husband was telling me. I was trying to pull out my tube. I was, banging on stuff, trying to get out of bed, just not all the way there. Like, they said I was feisty. And I am a feisty person normally, but they said I was on 100. So they were like, yeah, you were trying to pull out your tube, and they were constantly sedating me, getting me fentanyl, Versed, all that. Like, they were just trying to put me out and keep me out. Because once you pull your tube out, that's a serious issue. So they just were trying to sedate me, and I think I was in and out of it for maybe for 4 or 5 days, but I was hallucinating the whole time I was in the ICU. Like, the medicine that they were giving me was some serious medicine, and I would hallucinate. Like, it's funny because my grandfather, he recently passed, I think it was a year and a half ago, and he got a bone marrow transplant from his brother. And I would hallucinate and I would see him. And then my husband would be sitting there and I'll have my eyes closed and I'll be talking to him. And I'll wake up and Mark's looking at me like, who are you talking to? I was like, my pop-up right here. And he was like, no, Brianna, your pop-up's not here. So I would hallucinate for like the whole time I was in the ICU because the medicine that they were giving me was causing me to hallucinate. So the ICU was probably the hardest experience. I went into the hospital weighing 135 pounds. I left the hospital 98 pounds. So I lost all my weight. I loved going to the gym. Like, I would work out all the time and all that was gone within a week of being in the ICU. Like, they didn't feed me. So for a week and a half, I didn't eat, I didn't drink, I didn't do any of that. I had nothing. I think they gave me like the mouth swabs. And I remember the nurse saying, you can have the mouth swabs, but don't you swallow that water. And I was like, all right. And he left and I swallowed the water and I felt bad. And I was like, because so when you get a lung transplant, all like your swallowing is kind of relaxed and they're afraid you're gonna aspirate. And if you aspirate and it gets into your lungs, there goes your new lungs. So I swallowed the water and I was so thirsty. I didn't even care at that point. And I swallowed it and I felt bad and I was like, oh. And I told him, I was like, I swallowed the water from the swab. He was like, are you coughing? I was like, no. He was like, all right, don't do it again. I was like, all right, I'm not. Like, it was one and done. I didn't do that again. So the ICU, like I said, was the hardest part for me. Even like being in bed for a whole week, your muscles in your body just shut down. And I remember the first time getting out of bed and my feet were like cinder blocks. Like I was like this trying to walk. And because I didn't use any of my muscles for about a week and a half. So finally I would walk for like a little bit and, I would go back to bed. And then when I got extubated, that was my favorite part because I got to take a deep breath with my new lungs and I got to talk. I talked for 2 hours straight to my aunt and that was my favorite part. I got to breathe on my own. I mean, you don't really understand how important breathing is until you don't have that ability to do that anymore. So when I could breathe and take deep breaths and talk without huffing and puffing and coughing, like even my teacher was like, are you all right? And I'm like, it's just me, it's just what I do. But yeah, I mean, I was really
she's a really good student too.
I was really thank you. I was really, really, really sick. But I was so determined to get done nursing school that I would hop right. Like I remember I tested out and I came back to school with a chest tube in. Like I did not care. I was like, I'm coming back to school and I'm going to finish this semester. I was not playing. So I came in a couple of times with the chest tube. I would have it under my uniform and they'd be like, where's your chest tube? I'm like, it's under here. Chilling. So yeah, that I learned that being a patient that long, you kind of get a different type of sympathy for other patients. You have a connection with other patients that a lot of people don't. You understand they get lonely, they get upset, they get agitated. I worked as a S&E at Christiana for 6 years, and my tolerance for some patients got lower and lower and lower. And then I started to realize when I was a patient, I was like, well, this is why they are like that, because they're lonely, they're scared, they're agitated, they're not how they want to be. And it kind of gives you a different perspective as a healthcare provider when you're a patient yourself. So, yeah, that's my spiel about that. I had a couple of complications. I had an acute rejection, which is something that they said was normal. It upset me because I was like, I'm gonna get out of the ICU and I'm gonna go to step down and go home. No, I had an acute rejection, so they give you 1,000 milligrams of steroids over 4 days. And I was not a nice person because steroids make you mean, they make you hungry, they make you fat, they make you all that. And I was not a nice person. Oh, sorry to my husband, but I was not a nice person. And that's how they treat acute rejection. Now, chronic rejection is where like your body's rejecting your lungs and they can't really do anything about it. They can slow it down, but they can't do much about it. And then you most likely either die or get another transplant. So you have to, as a patient, I have to constantly worry about that. Like, I have to be diligent. I wear a mask to school. I get a lot of stares, but it's just protecting me. And a lot of people, they're like, why are you wearing that mask? And I'm like, I had a transplant. So sometimes I kind of have to say, I'm wearing this mask because I got a transplant. I don't want to get sick. Like, flu season's coming. I have to be very diligent. I wipe down my desk when I sit down. I wear a mask like if I'm close to somebody. He works in healthcare, so he has to be very cautious about what he does too, because if he gets sick and he comes home, he can get me sick. So it's not just me that's affected, it's my whole family. And it's kind of like a lifelong process. I have a illness or a disease that I have to manage my whole life. And another thing is the medicines that I'm on,